Welcome back. It is repurposing week, and I guess you could say we're giving our bodies a fine tune-up. If you or someone you know suffers from chronic pain, that you know how debilitating it can be and how it can really get you off your feet. Our next guest says he is here to help you. Joining me now is Dr. Rainer Kramer. He's the medical director from AZ Pain Centers to talk about breaking that pain cycle, eliminating the consequences and complications. Welcome back to the show. We appreciate you being here.
Thank you.
I want you to start by telling us what is a pain cycle and how do we know we're in one?
Well, the pain cycle usually starts with an injury or trauma to either a joint, a muscle, a ligament, or soft tissue. And the resulting inflammation, the resulting swelling that takes place usually results in inactivity. That inactivity creates additional pain triggers, and then you have this whole little circle or cycle of pain. Inactivity, pain, pain that fosters further inactivity, and there's sequela of that.
And you were saying that there's a difference between simple your health and then when, of course, the pain issues arise from being inactive. What are the differences there?
Right. Inactivity, especially due to a traumatic episode where tissue has been damaged, fosters an environment of deconditioning. Right? Because we're not moving, our muscles aren't moving, our blood vessels aren't pumping, our heart isn't moving, and it can create muscle weakness, as we see on the chart. It can lead to hypertension, diabetes, weight issues, joint and nerve pain and muscle pain, or chronic pain, as often we see in clinic. So what we're trying to encourage our patients, especially as the new year has begun, to look at increasing their physical activity and becoming more fit.
Yeah, you have one of the most interactive websites I've ever seen. You can really go in there and pinpoint exactly where your pain is triggered. Can you give us some suggestions on how we can help ourselves get through this pain?
Absolutely. We need to do simple things, because really when you're looking at changing people's behaviors, it's making little changes. So it means maybe walking to an area that you would formally drive to, or get involved in a water exercise class, or use an exercise bike instead of just sitting in front of a television, or using an exercise ball to sit on rather than a regular chair. Just moving, stabilizing core muscles, using muscles that are generally inactive. We have a culture that is fairly inactive, and we encourage our patients to collaborate with us, to become partners with us as we identify the pain triggers that they look at becoming more functional and more fit.
A lot of people avoid getting treatment because of fear that it could be painful. If you visit the AZ Pain Center, are there painless procedures?
We focus on giving the patient a very positive and painless experience in our office. We use comfort technologies, we use medications that are non-steroidal, and low-dose steroid procedures that are safe, that have a high safety threshold, and are very efficacious in reducing pain.
And there are a number of treatments that you guys offer.
Absolutely. We treat the spine primarily. We treat the joints, the hips, the knees, the shoulders. We've had effective treatments for each of those areas.
All righty. Well, and we also want to give you an opportunity to tell our folks how they can get to you. And you have a website, and that is azpaincenters.com. If you would like to make an appointment, or you can call the number on your screen, 480-821-PAIN. That's 480-821-7246. AZ Pain Centers, they accept most insurance plans. Just give them a call. There are new locations statewide, so there's probably one right in your neighborhood, with a brand new facility at the Chinese Cultural Center in Phoenix that is located at the Loop 202 and 44th Street.